Hello friends, welcome back to my channel Medicine of Anziron. Today we'll talk about chronic bronchitis. Okay, so from the term it's quite easy to understand that chronic means we'll get for the long term, and bronchitis means we'll get the inflammations of the bronchial systems. Right? So what is the most common, if you see in terms of the etiologies, try to understand the most common cause that can develop the chronic bronchitis, that is the what is smoking, right? Now how the smoking that will develop the chronic bronchitis, let's talk about those things. Okay. So if I write it over here, the most common cause that can cause the what? The chronic bronchitis is the smoking. Okay, now see, whenever we do smoke, at the time why? Whenever we do smoke, at the time we know that the smoke particles, this smoke particles, for example, this will go through the airways, right? And as we know, within the airways, there is the presence of what? Within the line of the airway, we will get what? The pseudostratified ciliated columnar epithelium, right? So if we just draw the cells over here, okay? So we'll get over here pseudostratified ciliated columnar epithelium, right? The same we'll get also over here. So see, whenever try to understand, whenever these smoke particles, they will try to reach through the through the what? From here to the inner structures of the lungs. What these things, if we see the structures over here, in the same way we'll get also over here, the pseudostratified ciliated epithelium, laminar epithelium. Now see, whenever these smoke particles, they will try to reach from this zone, that means from the bronchial systems to the the different kinds of the branches of the bronchus, and ultimately within the within the inner structures, we can say in terms of the alveoli, or you can say the lung parenchyma. Before reaching over here, whenever the smoke particles, they will come, okay, up to this region. At that time, these cells, as they are having the cilia, they contain the cilia. By the ciliary movements, what they will do, they will try to push back. They will try to what? They will try to push back the smoke particles. So whenever they will just try to push back the smoke particles from here by the ciliary movements, okay, the ciliary movements. Okay, they just try to push back the smoke particles, and as you know, these smoke particles ultimately that will reach where within the GIT, that will come where within the stomach, and ultimately within the stomach, as we know, there is the presence of what? HCl, and the HCl that will destroy the smoke particles. That's the one thing. Okay. Now, if we see the the individual who is smoking for long, that will get these cells, they will be irritated. We will get the irritations within the, we can say that we will get the irritations within the airway. So whenever we get the irritations within the airway, that leads to inflammations of the airway. So if we write it over here, whenever some individuals or any individuals who is smoking for the long time, okay, for chronic, if we see in terms of the long term case, so smoking. So let's write it over here that smoking first. Now this is smoking, that is causing what? That is causing the airway irritation in case of long term. Okay, in case of long term. Now here you can write the airway irritations. Airway irritation. As a result, we will get inflammations of the airway, right? We will get the inflammation of the airway. So whenever we get the airway inflammations, try to understand these cells, they can produce the mucus. So whatever thing we will see, they will produce the mucus. Now for example, I am showing the mucus with a black one from here, like the ciliary activity, cilia. These are the ciliars of the pseudostratified columnar ciliated epithelial cells, and they produce the what? Mucus. So we'll get the productions of the mucus over here, as well as over here also. We are getting the mucus. Now, at first we'll get the airway irritations for smoking, then we'll get what? The airway inflammations, right? We can write the airway inflammation. Now I'm writing it over here, we'll get the airway inflammation. Whenever you are getting the airway inflammations, try to understand from here, these cells, that means the pseudostratified columnar epithelium cells, they will produce the mucus, right? Ultimately we'll get the mucus from here. Okay, let's write in this way. We'll get the productions of what? Mucus. So we'll get mucus. Actually, this mucus, after producing the mucus, the airway, they will try to inhibit the small particles from reaching from these structures to the inner structures of the lungs. Whatever thing we'll see, as we know that mucus, they are what? They are gelatinous, or you can say they are having the gum-like properties. So whenever the smoke particles, they will come through the trachea, ultimately within the airway structures over here. By the actions of the mucus, those smoke particles they will get stuck where along with the smoke, mucus along with the. That means I am saying you guys that we can say that whenever the smoke particles they will reach from here to this region, the smoke particles they will get bound along with the what mucus structures, and they will get stuck along with these structures. As a result, we will not see the further movement of the smoke particles from these regions to the inner structures of the lungs. Okay, that's how we get the mucus productions over here. Now, as you know that mucus is the mucus is the better place whenever we are getting the mucus productions over here. This mucus is the better place for some kinds of the organisms, some kind of the organism. That means we can say that if we see over here, this mucus is the good place for living. This mucus, this is the good place for what? For example, the Haemophilus influenzae. Haemophilus influenzae. Now the Haemophilus influenzae, they would love to live where the mucus is deposited, where is the mucus is produced over here. So whenever we are getting the Haemophilus influenzae, they are they are what? They would love to live in these positions. As a result, we will get over here the secondary infections. So we can consider this thing secondary infection. And this secondary infection that can cause further the inflammation of the airway. Now see this, Haemophilus influenzae, or you can say the secondary infections for the producing of the mucus. This mucus is the good place for the Haemophilus influenzae or other kinds of the organisms. Now as a result, whenever the mucus is being a good place for the Haemophilus influenzae, we will see the development of the secondary infections. Okay, and this secondary infection that will again trigger the airway inflammations. So again this Haemophilus influenzae, or you can say the secondary inflammations, that will trigger the airway for the inflammations process. So we can say this secondary infection that will cause further airway inflammations. Again we will get productions of the mucus. So whenever we get productions of the mucus, we will get whatever thing we will get over here. We will get the cough, right? We will get the and okay, let's write it over here. Whatever thing we will get over here in terms of the mucus productions. Whenever we are describing any individuals or any patients with chronic bronchitis, in this case, definitely will get the productive cough for the production of mucus. So productive cough. So productive cough will get at first in the 3 months, and that will long last for the 2 years. It will appear in the 3 months, and that will long last for the 2 years in these cases. Okay. Now, along with that, whenever the mucus whenever you are seeing these cells are secreting in the mucus, as a result, the mucus that is what keep on depositing in these layers. So as a result, we will get a thick mucus layer, right? Whenever the mucus, we are seeing that mucus keep on producing by these. As a result, we will get a layer of the mucus. So whenever we are getting the thickened or mucus layer, here we will get the word thick mucus layer. Thick mucus layer. As a result, the Wright's index, I will talk about these things in the next part. Wright's index, that will be increased also. That will be increased. I'll say what is the ratio of the Wright's index, what are the other things, what about all these things. And ultimately, we'll see the what? Ultimately, we'll get the airway obstruction. So whenever we are getting the productions of the mucus over here, see, whenever we are getting the productions of the mucus over here, ultimately we will get what? The airway obstructions, right? We will get the airway obstructions over here. So ultimately for the mucus productions, we will get the airway obstruction. Okay. Now, at first, if we write it over here, this cells, this pseudostatic columnar epithelial cells, the pseudosteatoid ciliated columnar epithelium cells, they are producing the mucus to inhibit the progressions of the smoke particles from what? From these regions, from the tracheal regions to the airway. So from the airway to the ultimately of the inner structures of the lungs. Now whenever we are getting the productions of the, whenever we are seeing an individual who is smoking too much, as a result this will get the mucus productions that will be also increased. So whenever any individual who is smoking, okay, for a long time, in these cases we will get the mucus productions that will be also increased. So in these cases, sometimes we will see these mucus productions that will be not able to resist, to inhibit the smoke particles, to inhibit from going from these regions to the inner structure of the lungs. So in these cases, if we see the mucus production that is not able to inhibit, minus means inhibit, okay, not able to inhibit the what smoke particles, or we can say whenever the mucus productions that will be not able to remove the smoke particles from this region, this thing is known as stasis. This phase is known as, or this condition is known as stasis. So what is stasis? How can we define the stasis? Let's talk about that thing only. So whenever you're getting the mucus productions, so whenever for any individual who smokes for a long time, in these cases we'll get the mucus productions that will be also more. So whenever more produced mucus, that will be not able to remove these particles from these regions. This condition is known as stasis. Okay. Now what type of the manifestations we'll get over here? Now see, as a result we'll get, whenever we're getting the mucus productions over here, the airway that will be what? The airway that will be obstructed. Now let's talk about first normal airway. For example, is the normal airway. Normal airway. And in these cases, as I said you guys, we'll get the obstructions for the productions of the mucus. So in these cases, I have just drawn the airway of an individual who is having the chronic bronchitis. In these cases, we'll get what? We'll get the obstructions. We'll get the obstructions. As the patients of the chronic bronchitis, we're getting the obstructions. Basically, you will get what in terms of the mucus? It is the what is the mucus. And we can get also this type of thing in obese individual. Obese individual. Okay, so is the mucus. So try to understand in these cases. For the same regions we'll get over here, that whenever the airway that is getting obstructed, so ultimately we can say over here we're getting the obstructions of the airway. So whenever we are getting the obstructions of the airway, try to understand definitely the less amount of the oxygen that will be able to reach from these regions to these regions, that means to the target organs. In these cases we'll get the oxygen level that will be reduced, right? Because through these regions, because we are getting the obstructions over here. So whenever we are getting the less amount of the oxygen that is passing through these regions, through the airway, that will develop the hypoxemia. It will develop hypoxemia. And whenever we will get the hypoxemia, in this case, try to understand, whenever we will get the hypoxemia, definitely the oxygen level that will be less, and we can get in on conditions in terms of the chronic bronchitis that is known as blue bloaters. So what is blue bloaters? In this case, let's talk about that thing. We get the blue bloaters. What is blue bloaters? In these cases, whenever we are getting the development of the hypoxemia or the obstructions within the airway, or we are getting the obstructions for the depositions of the mucus, okay, in the chronic bronchitis patients. Now here we get the development of the blue bloaters for the deficiency of oxygen. So when we are getting the deficiency of the oxygen, whatever significant clinical manifestations we will get, in these cases we will get the skin that will be bluish, along with the what? This lips, this will be bluish colors. Okay. Now whenever we are getting the hypoxemia, try to understand, let's use the different parts for it. Whenever we will get the development of the hypoxemia, that will leads to, whenever we are getting the development of hypoxemia, that will leads to the vasoconstrictions. In these cases we will get the vasoconstriction at pulmonary blood vessel. pulmonary blood vessel. So try to understand. I'll explain again. Don't worry. Vessel. Now in this case, try to understand whenever you're getting the development of the hypoxemia, just to maintain this thing, we'll get what? The vasoconstrictions at the pulmonary blood vessels. So in this case, if I just draw over here, we'll get the vasoconstrictions over here. We'll get the vasoconstrictions, right? So whenever you're getting the vasoconstrictions, try to understand, definitely we'll get the development of the pulmonary hypertension. So as a result, we'll get the development of pulmonary hypertension. So whenever you're getting the pulmonary hypertension, try to understand, whenever you're getting the pressures within the lungs that is getting increased, definitely the work of the right heart that will be increased whenever you're getting the development of the pulmonary hypertension. From these things, from the from if we just apply the concept over here, from the basic knowledge we can say for the right heart, the work that will be increased. So the work of the right heart that will be increased for the development of the pulmonary hypertension. So you can write it over here. In these cases, we can show over here also that the work for the right heart so it a little bit of it. So in this case, try to understand the work of the right heart. That will be increased. So whenever the work of the right heart that will be increased, sometimes the pulmonary hypertension will be so much that the right heart that is not able to function properly. Sometimes you can get the failure of the right heart. So whenever we will get the failure of the right heart for the development of the pulmonary hypertension in case of the chronic bronchitis, this the failure of the right heart that is known as cor pulmonale. So what is cor pulmonale? If we write it over here, ultimately, okay, I'll explain this thing once again, guys. Enjoy. Or pulmonal, last E, it's the E. Pulmonal, L-E, okay? The cor pulmonal. Okay? Now, we'll talk about these things right now. At first we got, try to understand whenever we're getting any individuals or any patients of the chronic bronchitis, in these cases we're getting the mucus depositions within the airway. So whenever you're getting the mucus depositions within the airway, that leads to the obstructions of the airway. Whenever you're getting the obstructions within the airway, definitely the oxygen deficiency will be there. Ultimately we'll get the development of the hypoxemia. So whenever we'll get the hypoxemia, sometimes we can see this bluish skin color on the face, lips also, that is known as blue bloaters. Now, whenever we get the development of the hypoxemia, in this case, pulmonary blood vessels. Just to maintain this thing, we will see the vasoconstrictions at the pulmonary blood vessels level. Now, that will lead to the pulmonary hypertension. Now, whenever we will get the pulmonary hypertension, the right heart that will be increased. So, in these cases, sometimes we see that the pulmonary hypertension will be so much that the right heart that will be not able to maintain that much work, that much ability the right heart will not have that much ability to maintain this situation, and as a result you can get the right side heart failure, and that is known as cor pulmonale. Hope it's clear for you. Okay, now we'll talk about that what are the changes we will see in case of the cells. Okay, we can get the squamous mutations. As we know that the pseudostratified ciliated columnar, pseudostratified ciliated columnar epithelium. Okay. Sometimes we can see whenever any individual is smoking, the doctor has strictly prohibited the smoker not to smoke further. But if the smoker doesn't care about the doctors, if he continues smoking, whatever the problems he is supposed to face in this case, so this cell that will be converted into another shape of the cell. Okay, and that is known as squamous metaplasia. You will get the squamous metaplasia. Squamous metaplasia. Now we can get the airway disease, some airway disease. For example, you can get for the smoking purpose, what type of the disease you can see. So whenever any individual who is smoking, what type of the thing we can get? We can get the emphysema, plus we can get the chronic bronchitis. So what type of the problem we'll see in these cases, try to understand. And these two things together, they are known as what? They are known as COPD, right? They are known as COPD, chronic obstructive pulmonary disease. It's known as, okay, let's write it clearly. It is known as COPD. So we'll get the development of the chronic obstructive pulmonary disease. Okay. Now try to understand from here, any individual who is developing the chronic obstructive pulmonary disease, definitely in these cases we will get the irritations, right? Whenever we will get in these cases the airway irritations. As we know, there is the phrenic nerve. Sorry, what's that? What type of the nerve is over there? Okay, let's write it over here. Vagus. In these cases, we will get the airway irritations. Airway irritations. Now, whenever we get the airway irritations, as we know, the vagus nerve that supplies over here. So for that region, we will get the vagus irritations. So whenever we get the vagus irritation, whenever we will get the vagus nerve irritations over here, the vagus nerve that will release more amount of the what? Acetylcholine. So whenever the vagus nerve that will release more amount of the acetylcholine, for that thing we will get the development of what? Bronchospasm. Bronchospasms in these cases. So whenever more amount of the acetylcholine that will be released, we will get the constrictions of the smooth muscles. Ultimately, we can see the development of the bronchospasms. In terms of the COPD, if we say that as we know that in terms of the COPD, we will get the airway irritations. For the airway irritations, we will get the vagus nerve irritations. Whenever the vagus nerve that will be irritated, at that time we will get the more productions of the acetylcholine, and this acetylcholine that will lead to the bronchospasms. Okay, now how can we just do the treatment in these cases? Okay, let's talk about the management of the treatment. Okay, so if we talk about in terms of the treatment, how can we just do the treatment? At first, we can supply the oxygen from outside, so oxygen supplementations, so oxygen supplement. Second, we can use some anticholinergic drugs because it is for the cholinergic activity. We can use some anticholinergic drugs. So whatever anticholinergic drugs we can use the ipratropium. We can use ipratropium through the nasal spray. Okay. In terms of the nasal spray, and another things we can use, as we are getting the depositions of the mucus, so we can use some mucolytic drugs or the antibiotics because of having the chances for the development of the secondary infections. We can use over here some mucolytic drugs, or you can use the antibiotics. Like this, we can just do the management of the chronic bronchitis patients, or you can say in terms of the COPD. Okay. Now let's talk about these things once again. See, whenever we are getting an individual who is having the chronic bronchitis, in these cases we are getting the mucus depositions within the airway. As a result, we are getting the obstructions within the airway. So through the airway, the oxygen supplementations that will be less. So whenever we are getting the deficiency of the oxygen for the obstructions within the airway, we are getting the development of the hypoxemia. So whenever we are getting the hypoxemia, just to maintain these things, we will get the vasoconstrictions at the pulmonary blood vessels level. So whenever we are getting the vasoconstrictions at the pulmonary blood vessels level, that will lead to the formation of pulmonary hypertension. So for the development of the pulmonary hypertension, we will see the work of the right heart that will be. Sometimes if we see that the pulmonary hypertension that will be so much, that will be so severe that the right side heart that is not able to maintain that situations. For that thing, we can get the right side heart failure, and that thing is known as cor pulmonale. And as far as the the COPD is concerned, here I already explained you, will get the airway irritations. further it will get the vagus irritations that will release more amount of the acetylcholine, and ultimately will get the bronchospasms for the smooth muscles constrictions. And as far as the treatment is concerned, we can just do the oxygen supplementations, we can just do the, we can use the ipratropium, anticholinergic drugs, we can use the immunolytic drugs or antibiotics, as there is chances for the development of the secondary infection. That's why you are supposed to use these things. So this was all about in terms of the chronic bronchitis. In the next part of the video, we'll talk about asthma. Okay, in details. Thanks for watching, guys, and please do like, subscribe.